So nearly all the videos I've uploaded on this channel, maybe except the last 2 or 3 videos I shot while in residency. That means I was actually training to be an orthopedic surgeon. And right now I'm done with school, no more exams and stuff. And so in this video, I've decided that I will take you guys through the journey of what it took me to actually be an orthopedic surgeon in Kenya. I know a lot of you guys subscribe to this channel after watching my medical videos, like how to be a doctor in Kenya and so on, but you know that I post much more than that. So if you came on board after watching that, here's another one for you. Let's get started. So now, to make this simple for those of us who are not from a medical background or who want to be doctors but are not yet there, let's start from the basics. Who is an orthopedic surgeon and what do orthopedic surgeons do? Okay, we are doctors, specialized doctors who treat bones and joints. In a nutshell, that is the simplest way I can put it. Examples of conditions include infections and tumors in the bones, that is like the musculoskeletal system, and injuries like fractures of bones, the spine, the pelvis, the femur, the tibia, and what have you. So that is what orthopedic surgeons in a nutshell do. That is what I do. And when it comes to joints, we're talking about stuff like arthritis, we do joint replacements, we do injections and all these other things to make guys walk comfortably and without pain. So generally, that's what we do. In a nutshell, there's much more to it than that, but yeah, that's a good place to start. Okay, now why did I choose to become an orthopedic surgeon? And that is actually a difficult question, as the truth is, first, there's a lot that went into that decision. In my case, I actually just wanted to be a surgeon. That is how far back I can remember. After completing my undergraduate medical education at the University of Nairobi, which took me 5 years up to the year 2013 when I graduated, I did 1 year of internship, after which I think my interests lied most in surgery because I'm a hands-on person. You guys have seen me building computers, you guys have seen me doing this and that, and I really wanted to do something which I get up out of the desk and do much more than just ward rounds and seeing patients in clinics. So my options after internship were actually obstetrics and gynecology. I nearly became a gynecologist. I actually even went for obs-gyn interviews, neurosurgery and orthopedic surgery. Now, to join a master's in medicine program in Kenya, normally you need to do an interview which is written and also oral. You actually do a written exam which is difficult plus an oral interview. Now, in 2017, I was ready to specialize to start my master's program. Before then, I was actually a medical officer. That means I had my undergraduate degree, I had completed my internship, and I was employed by the government as a doctor in the cadre called medical officer. That is like a general practitioner. So now when the interview season came along, you normally can apply for more than one specialty. And now at this point, I had settled in my mind that I want to be either one, a neurosurgeon, or two, an orthopedic surgeon. And so I applied for neurosurgery and orthopedic surgery in the University of Nairobi. They do offer both of those courses. This is Masters in Medicine. And secondly, I applied for orthopedic surgery in Moi University. I was lucky enough to get admitted into both Moi University and Nairobi University orthopedic surgery programs. I am sorry if my admission to both sides of the divide probably made someone miss a spot. But anyway, there's always a waiting list, which caters for those doctors who do not make the cut to get admitted, but might actually get a spot in case someone who was admitted does not report. Now, the neurosurgery story is a bit of an interesting story. It speaks to some of my weaknesses. And the point is, I actually did not go for the neurosurgery interview. Not because I had known that I'm already admitted into orthopedic surgery, but really just because I missed the interview. The interview started too early in the morning. I got up late. I thought that the interview would start at 9 a.m., just like the ortho interview had started at 9 a.m. I walked into KNH at 9 a.m. When I arrived, I saw guys completing the exam, and that is how my neurosurgery dreams were shattered. Anyway, it's not like I lost it all because I also really, really liked orthopedic surgery. And so far, I'm very happy and comfortable in orthopedic surgery. So now what happens after that is, after getting both the admissions, I had to choose between University of Nairobi and Moi University. And I decided to go for Moi University. Now, why did I decide to choose Moi University over the University of Nairobi, where I had gotten my undergraduate medical degree? Number one, reputation. The orthopedic surgery program at Moi University had quite a good reputation in terms of, support, completion, exposure, training, and, just the environment in Eldoret. Two, orthopedic surgery in Moi University was actually shorter. 4 years. I'm this kind of person who wants to save as much time as I can wherever I can. And luckily, even in undergraduate, I went to the University of Nairobi, which took me 5 years to get my Bachelor of Medicine and Bachelor of Surgery degree, rather than Moi University, which would have taken me 6 years. And so, I can argue that I saved 1 year in undergraduate and 1 year in postgraduate, hopefully. And the last reason is, having worked and stayed in the western part of Kenya, mostly I had my interests, as it were, in the western region. And so Moi University in Eldoret would have been a better fit in terms of me continuing my other ventures other than school. Yeah. So I decided to get into Moi University, and here we are. I'm done. So 4 years non-stop, despite COVID, despite lecturer strike and all these other things, I thank God that I actually cleared my master's in medicine on time. And also much appreciation to the staff and the department, the head of department, and everyone around Moi University Orthopedic Surgery department, and also MTRH, the hospital. They gave us a lot of support to ensure that we clear on time. But then there's also another route, another program. Apart from the Masters of Medicine degree, you can actually become an orthopedic surgeon in Kenya. If you get into the collegiate system, there's actually a system called COSEXA, College of Surgeons of East and East, Central, and Southern Africa. Okay. College of Surgeons of East, Central, and Southern Africa. That's another way you can actually become an orthopedic surgeon in Kenya, by getting into their membership program, which takes you 2 years, then their fellowship program, which takes you 3 years. I personally went for the Masters of Medicine degree, but in the past few years, it seems like COSEXA is actually gaining much more popularity than MED. But then, after clearing that, you don't really just, get registered as an orthopedic surgeon, as a specialist. You actually need to do some years, about 2 years, before actually getting your license from the board. So in total, if you are to start right now from undergraduate degree to be an orthopedic surgeon in Kenya, you will take 6, because there's no medicine program for less than 6 years right now. Plus 1, plus 2, give or take, that's 9, plus 5, plus 4 or 5. So it will take you about 14 years. That does not mean that I'm old. I'm actually not that old. I am 30 years old. Anyway, I'm quite a young one. Now let's chat a little bit about what it's actually like to train to be an orthopedic surgeon. When you're training, normally you're called a registrar or a resident. So residency program, like in my case, having taken the MED route, has 2 parts. There's a part 1 and a part 2 residency. In the University of Nairobi, for example, it would have been 2 years of part 1 and 3 years of part 2. But in Moi University where I went, it was 1 year of part 1 and 3 years of part 2. So part 1 basically is like basic sciences. You start revising the same stuff you did in undergraduate, but in a little bit of a more focused or detailed manner. So in our case, for example, we actually started doing anatomy afresh. We did dissections for the whole human body using a cadaver that's like a dead person. We did biochemistry, we did research methods, and all these other tiny basic science courses here and there. Anyway, in MED, I spent the past 3 years doing my part 2. And in part 2, what happens is actually now clinical rotations. You treat patients one-on-one in the wards, in clinics, in external rotations, you go to other hospitals. And so part 2 involves more of the hands-on experience with patients. It's more like an apprenticeship where you actually work under qualified surgeons, so they teach you the skills. You see, the difference between masters in medicine and most other disciplines is that in medicine, it's more like a training than actually a book thing. It's more like an apprenticeship. You need to be there to treat people, to do very many cases. There's a place we actually log all the cases we do. And by the time I was done, I actually found that in my logbook, I had done more than 450 surgeries. So yeah, you see, it's kind of like a training intended to give us the experience it takes to actually work independently as surgeons out here. The training is usually divided into these things called rotations. They're like sections of the training which you actually need to pass through so that you can experience all the different branches of orthopedic surgery. You see, like there's arthroplasty that deals with, joint replacements. We have spine surgery. We have trauma that is actually like guys who get accidents and falls, breaking their limbs and their pelvis and all these other things. There is pelvic and acetabular surgery. There is sports surgery or sports medicine, as it were. So all those are like rotations. There's also pediatric orthopedics, treating bones and joints in children. And so you need to take a number of months in all those rotations. Okay, so as a resident and also right now as a surgeon, I see a lot of these patients in different clinical areas, mostly clinics. Clinics are just like outpatient encounters where, you go sit somewhere and patients who are not admitted to the hospital walk in or are brought in by wheelchairs or stretchers and so on, so they can consult you. And that's one way we were exposed to many patients. That's one way we learn. And that's one way we actually treat patients even as surgeons. 2, inpatient, that is patients who are actually admitted into the wards in the hospital for one reason or another. We see those patients over there, we manage them. And another area that is very crucial to us as surgeons is actually theaters. We see patients over there, we operate on them, and we are happy when they get better. So that's more like what we do. But as a resident, apart from that, there's also the more academic part of it all. That is like making presentations in classes. But interestingly, masters in medicine classes are not really that much compared to the clinical work. Like in our case, we only actually did like 1 hour per day at most, sometimes even none. Yeah, so the majority of time was actually spent treating patients. What about exams? Interestingly, there's actually not that much exams as one would expect, but this is university dependent. In our case, for example, in Moi University, you only need to do 2 main exams. There's a Part 1 exam after you're done with the 1 year of Part 1, and there's a Part 2 exam after you're done with the 3 years of Part 2. And in between that, there's really nothing. The exams, however, are actually quite rigorous. They are not a joke. Like the Part 1 exam, for example, in anatomy would involve both practical and written aspects. In anatomy, you are given a paper 1, a paper 2 to write, and it has a lot of essays, a lot of MCQs, that is multiple choice questions, like hundreds of them. And then you go do a practical exam where all those body parts or cadavers, that is the dead people, are brought over there. And they can open up somewhere here and tag a small vessel. Then you're asked questions about that vessel. There's even a part where you do like an exam using microscopes. It's called histology. There are slides of some cells from different parts of human bodies where you look at, and it's just a lot of stuff generally. The Part 2 exam also has written and clinical aspects. In our university, for example, we actually did like 3 written papers. Each of them has like 100 multiple choice questions and 5 essays, which you need to write. And by the time you're done with one paper, you feel like it's the end of the world. Then there's also the clinical exams where some external examiners, that is like lecturers, surgeons from University of Nairobi, other places, come around, and then you are given patients to look at and discuss their conditions. That's what the exam in a nutshell looks like. So after you're done with that and everyone is happy with what you've been doing all through the 4 years, how you've been working, and you've passed your exams up to until that point, then you are ready to become an orthopedic surgeon. But wait, that's not everything. You actually need to do some research. And in our program, we actually needed to do a master's thesis, and I did mine on a condition in children called clubfoot. And I wrote my thesis and defended the thesis in front of a board from the whole school of medicine. And they, were happy that it's a good thesis. So generally, that's what it takes to be an orthopedic surgeon in Kenya. And so if you'd like more of such videos, comment down below. Let me know that you want to see more medical videos. And also subscribe to this channel and hit that notification bell so that you do not miss any of the weekly videos I upload. If you've liked this video, there's the like button. It's just somewhere down here. Like it. Okay, so what next from here? It's not the end of the world. It's not the end of study. I still intend to do more in terms of growing myself as an orthopedic surgeon and getting deeper into the career. There's something called subspecialization, where you actually decide on one area of orthopedic surgery and you get into it and study and get more exposure into it in terms of like doing what is called a fellowship. Like say I'm interested in spine surgery, I want to go to like a hospital that does a lot of spine surgeries under someone who does a lot of spine surgery, work with him for like 6 months, 1 year, and then come out as a subspecialist in spine surgery. You see, there is still some road ahead. Not all the water has passed under the bridge. There's still water upstream. So yeah, that's what we're looking at in the next few years. Yeah, that is it for this one. Thank you guys for watching, and I'll see you in the next one. And as always, no pressure.